Top story the world is watching closely, from Bob Dylan, the Beatles, Woodstock in the 60s to the president's desk just this past weekend. Could the drug they used to paint the world in Technicolor improve Americans' mental health? Well, last year we learned how psilocybin can help treat some mental health conditions, and now we're learning that ibogaine could as well. President Trump now opening the door to more research, signing an executive order over the weekend to fast-track studies for ibogaine, with the hopes that it can one day help treat addiction and PTSD.
On the 250th year of our nation's founding, everyone who has fought for this day through decades of monumental struggle, sacrifice, and suffering can now declare a seminal victory for life, liberty, and the pursuit of happiness.
CEO for the nonprofit Americans for Ibogaine calling the order a, quote, epic victory for all humanity. Last year, 73,000 Americans died from an overdose. Right now, around 6 million Americans are addicted to opioids. 80% of people say ibogaine eliminated or drastically reduced addiction withdrawal. 30% of people never used opioids again after ibogaine treatment. Olivia Young, your reporter in Douglas County, joins us live on set tonight. And Olivia, you've been talking with a man in Parker about his experience with ibogaine. And ibogaine comes from the, let me get this right, iboga plant, which grows naturally.
Yeah, that's right, Karen. It is a naturally occurring psychedelic compound found in the root of an African shrub. Now, while many people may just now be learning about ibogaine, it's been on Colorado's radar for some time. Voters passed the Natural Medicine Health Act in 2022, decriminalizing ibogaine and other psychedelics. Then last September, Colorado's Natural Medicine Advisory Board voted to recommend adding ibogaine to Colorado's natural medicine program. But there's still working out the details of what that will look like.
This medicine is going to solve the opioid crisis.
Adam Vibe Gunton's addiction started young.
I was introduced to cocaine when I was 12 years old.
Cocaine turned to OxyContin, then heroin and homelessness.
I did everything this world has to offer, trying to stop, and nothing was working.
Until he tried ibogaine in Mexico.
I had no withdrawals, no cravings. It was as if I didn't want the drug anymore.
That relief was short-lived.
So I went back to the same apartment where I was alone, dirty, same friends, and within a couple months I'd relapsed.
Hey!
Eventually, through a 12-step program, Adam was able to get clean. He believes ibogaine could be the solution to opioid addiction.
Ibogaine has this crazy ability to completely reset that thing that causes addiction. But we have to create all those new habits.
But the treatment is not without risks.
And so that's where we have to have caution here as we roll out a ibogaine protocol here in Colorado.
Dr. Andrew Monty says early research suggests ibogaine has potential in treating addiction and PTSD, but it can impact the heart, sometimes leading to a fatal arrhythmia.
100% of people that have gotten the drug have QT prolongation. Yet we think that only about 1% of those people ultimately have this cardiac arrhythmia.
In 2021, Colorado Springs bodybuilder Andy Hammond died. An autopsy listed ibogaine toxicity as his cause of death, with other contributing factors including an enlarged heart. The self-described guru who gave Hammond the treatment was recently sentenced to 4 years in prison.
This drug must be taken in a medical facility with the appropriate training because otherwise this can be quite dangerous and people may die. There have been no phase 3 clinical trials, and so we're many years away from an approved pharmaceutical.
A bill at the state legislature would create an ibogaine research pilot program, and President Trump's executive order makes more funding available.
I think that this is way overdue. This is going to save lives, period.
In the 8 years he's been clean, Adam has written a book, given a TED Talk, started a nonprofit, and a family.
Hi, baby girl.
It's a second chance at life he wants to help others find.
Well, I'm not going to say on TV that I have a full business plan and I cannot wait because we're going to be the biggest and the best, but we are.
Now, Dr. Monty points out there are already safe and well-researched treatments for opioid addiction like Suboxone and Methadone. Those treatments are often long-term, while advocates for ibogaine say it's usually a one-time treatment, Karen.
So what about people that are thinking that they might use this recreationally? Can they even do that, and is that even advised?
Well, yeah, Karen, that's something that both Dr. Monty and Adam worry about just because of the risks of the medication. Ibogaine should only be used in medical settings, not for fun or a spiritual journey.
So we'll continue to learn more. Thank you so much
Certainly.
for this, Olivia. Thank you.